two most pressing challenges that Cal Connect faces are sustainability and policy and standards development. Sustainability, we're charged actually with creating this infrastructure, but there has to be a way to sustain the exchange effort beyond the stimulus dollars that have been awarded. And so for us, it's figuring out what the value proposition is at the various levels of stakeholder involvement so that we can ensure that the exchange effort continues beyond the infusion of money that came from the feds. The other is really around policy and standard development. Simultaneous to us building a technical infrastructure for exchange, the federal government is defining the rules and creating the standards and the policy that govern that exchange. And so sometimes there's a little bit of a fear or angst of California getting ahead of the game, but at the same time it can be invigorating because we think we have the opportunity to influence that policy development as it's taking place. The challenge of sustainability, I think the biggest hurdle is educating consumers of healthcare around the value of health information exchange. And those consumers can be defined not only as patients or individuals who are managing their own healthcare situation or their families, but also the providers of healthcare, because ultimately they're the ones who purchase the technology and implement that technology in their practice that results in this data flow. And so I think one of the biggest challenges is doing this grassroots effort around educating people around why this is important and creating some imperative that really moves the marketplace. The challenge of standards development and policy development, I think the biggest hurdle is really time. And it's almost like we have to make a decision as a state. Do we want to get ahead of the curve and try and provide some level of influence over what those standards are? Or do we sit back and wait for the federal government to define and then to regulate in a way that maybe doesn't make sense for our state or for our community? And so it's really a matter of making a decision and then being willing to stick with the consequence of the decision once it's made.